physical problem, you want somebody to answer the question, why? Why am I having this problem? It's all fine to say, oh, you have piriformis syndrome, or oh, I have IT band syndrome, but you want to ask yourself why. Now, I can understand the why would be obvious if you got hit or you got run into or you fell or something like that. Some traumatic injury caused your problem. But if you've been going on in your training program, so you're a runner and you've been running and you've been going through your training program and you've been fine mostly for the whole entirety, and all of a sudden now you've developed a problem. What you really want to ask yourself is why. It's not really diagnostic or it's not really an evaluation. If you go to a physical therapist or a practitioner who says, oh, well, you came in and you told me you have lateral knee pain. Well, then it's an IT band syndrome. That's great. That's descriptive, but that's not evaluative. That doesn't really tell you, why do you have that problem? And so first off, palpation is the skill that we use in this clinic, and osteopathically we use to determine or to help us determine what are the problem points. So for example, coming in and palpating, actually touching those structures and saying, that's interesting. There's all sorts of things that lead us to why you might have an IT band syndrome. Is it a foot ankle dysfunction? Is it a hip dysfunction? Is there something with how, since in running, for example, the opposite arm is supposed to rotate and move with this leg. So if it's a left leg problem, oftentimes there can be a right thoracic or right neck or right shoulder problem that's helping exacerbate this, and the IT band is making up for it. So to really get to the bottom of your problem, why? Why is your problem there? And if you're going to practitioners who aren't palpating, they're not touching you, they're not poking around and looking at the possibilities. For example, most people will not understand that they have pelvic floor dysfunction and knee pain together. Those, they say, hey, look, my pain's right here. The traditional medical community wants to draw a 6-inch box around that and treat that 6-inch box. The problem with that is that's not how the human body works. I've never seen a knee go running down the street all by itself. It always somehow is attached to a whole person. And so getting to that why, getting to that deeper problem is key to really getting to the root of it. And simply telling patients, just quit running or quit doing your activity, quit gardening, quit doing whatever it is you're doing, and it'll all be fine. That's not really the treatment you should be looking for. You should be looking for a why. Why do I have this problem? And once we define why you have the problem, it's much easier to do a lot of things to fix that. It becomes far more obvious what interventions should be put in place, from treatment to self-care to changing the way you run or doing something different with how you set yourself up for gardening. So it's very important. So I really hope that you're getting that information where you're being cared for. And if you're not, well, then you should come in and find out why you have the problem.